My name's Barbara Doty, and I work with Caremore Health Plan. I'm the broker manager. So luckily, I was able to meet most of you during open enrollment. But again, it now being lock-in, we wanted to take that time just to review our special needs plans with Caremore, because we understand, of course, during open enrollment, you're definitely bombarded with all kinds of different information. We kind of specialize in that special needs, so of course, we wanted to just recap, review. If you've sold this in the past, this might be a refresher for you, and really kind of get you some insights on qualifications for these plans. And Manuel, are we okay to start? I'm going to assume so, but again, welcome. First
We
off,
are. Go ahead.
okay, very good. Oh, and now let me make sure I can get this going. Hang on. Here we go. What I wanted to start off with first is just to make sure that you know how to access all of the information that I'm reviewing today. Of course, just going to our website, that www.caremore.com. I kind of circled that locate services. That's probably going to be where you're going to spend the majority of your time. That will give you a list of all of our network, our hospitals we contract with, all the specifics of the different plans. So when you have some time, again, just kind of explore that on the internet, and it can kind of show you all the different information that you might need before you might meet with a client. The other thing that I did want to mention, we just recently launched our brokered portal. So it's not seen on this screen, but when you go to the website, you'll see this home page here to the upper left-hand corner, kind of in this general area. It will say broker portal. That is something new that we have live. You will have to have a writing number. So most of you are already certified to sell with Caremore. It's that BKR number. You can request access through that broker portal on the website, and then that will give you permission to get into our, of course, confidential information directly with you. On that portal, differently than this website, it will include a lot of the training materials based on the different markets. I know some of you maybe sell in LA, Orange County. It looks like we have a couple of you from Northern California. So it will give you all of those specifics market by market if you are looking for a specific benefit plan within that area. So kind of explore that a little bit. Again, you're welcome to. It will give us a day to give you access, and then you can definitely have access to even more information than what you'll get on this general website. The other is we did launch some marketing flyers that are generic, that of course are CMS approved. By going through that broker portal, you'll have a way that you can download those, enter your phone number, enter your name, and there's specific, of course, special needs plans flyers for you to use in your particular market. So spend some time on the internet and you'll get some more information that you might need. But just to review and recap for our portfolio of what we have for 2016, we do have our Start Smart Plus. That's typically for our healthiest senior. These are the folks that are maybe new to Medicare, coming off of a supplement, don't really plan on anticipating on utilizing a lot of their Medicare dollars. The key with that one is they do get a $50 premium reduction off of their Part B. So that's a good kind of reward for them. Again, a lot of them don't like to pay that $104.90. This will actually credit their Social Security check $50 each month that they are enrolled on the Start Smart Plus. The other plan that's pretty basic and generic is our Caremore Value Plus. Again, these are people with health issues, but not serious chronic conditions. They pretty much, have, maybe go to the doctor once or twice, want to have a backup plan as a Medicare Advantage, and they typically will have lower copays, where the Start Smart would have slightly higher copays just because, of course, they're getting that $600 credit for that annual year. This morning, what we're going to concentrate, of course, is on these special needs. For Caremore, we do have our diabetes plan, we have our heart plan, our breathe plan, and our ESRD plan. So, of course, going back to the diabetes plan, we do have, a full care model of support through our care centers. specifically to cater to those diabetics. Our goal is to really kind of keep their A1Cs down, keep their high blood pressure down, really try to encourage them exercise and diet through different programs that we have. A lot of medicine management, so we will definitely keep track of their medications to really kind of cater to their needs to eliminate any type of amputeeism or any type of heart attacks or strokes. For our heart plan, these are folks obviously who have had a heart attack in their medical history dealing with congestive heart failure. For us, we do have an anticoagulation program at our care centers. It's a lot of that blood pressure medication management just to make sure that we keep them monitored. We do offer these folks a weight scale so then they can take that home. We pretty much are monitoring them 24 hours through a care center line that we have, just so when they are sending in their weight each morning, if it escalates 5 pounds or more, we actually reach out to them, whether or not you've had anybody in your past have a heart condition. A first kind of preliminary sign is their lungs will fill with fluid. Hence, that's the reason why we want to monitor their weight. So we definitely want to be more preventive in nature to try to eliminate any future strokes or heart attacks. For our breathe folks, these are all of our folks who have that COPD or have, um, you know, dealing with oxygen tanks or having trouble in their past with that, specific lung circumstances. So we have a lot of different programs within our systems to really kind of help monitor them. And then last but not least is our ESRD plan, our end-stage renal disease. Again, this is very specialized. There's not any other plan, I don't believe, within California that offers it. There is some specifics, of course, they do have to already belong to a dialysis center. I can get you the list of our dialysis centers that we do contract with, but definitely we can offer that in our LA, Orange County, and San Bernardino areas. So let me know after this call. I'm welcome to take questions and we can kind of run through. I'll give you the specifics on conditions in the next couple of slides. But if you know of anybody particular in the ESRD, let me know and I can help you along. The other new plan that we offered for this year is our Connect Plus plan. Now this one is different than our DSNP that we had years past. For our Connect Plus is the one that we're offering this year. It is our full dual eligible folks. They do have to have, that approval through Medicaid and of course Medicare, and it needs to be that full dual. With that, of course, there's a lot of coordination. Typically, everything's zero copay. They can get their medicines, and it's a lot of coordination of care because typically those folks will have, aligned with any of these chronic conditions where we can include them in these special programs. Last but not least is our touch plan. Now this is unique for our folks who are at an assisted living or who are dealing, at a nursing home. For today, our brokers don't have access to sell this independently, but if you know of anyone who might need our services, by all means, reach out to me directly. I can get you in contact. We would give you credit for the sale and have you the agent on record. But again, it's very specific because, of course, it's not all assisted livings or all nursing homes. It is specifically contracted facilities that allow Caremore to go in and utilize our services. All right. The other programs that we are offering this year is our brain health program. This is for our seniors. Again, a lot of dementia going on with seniors, losing their sense of memory, things like that. We have incorporated programs at our care centers to really kind of help folks manage through that. So it is a new program. Again, it comes in with a lot of, integration of trying to help increase that memory. So we're very excited about this program and are offering it at all our care centers. The other is our diabetes prevention program. We've been kind of course, specialty in that diabetes, but you always kind of hear of our folks who are on our Start Smart or maybe our Value Plus who aren't diabetic and want to learn how not to become diabetic. Hence, it's this diabetic prevention program. It's all of our folks who want to learn and operate and understand nutrition and diet to really try to eliminate that risk of ever becoming diabetic. So again, it's offered at each of our care centers. It's very unique and, of course, phenomenal for them to really kind of understand if they're concerned, what healthier choices there are out there. They can be a part of those programs. All right. So for our chronic needs, we're going to talk the diabetic, the breathe, the heart, and the ESRD. Again, we already said our Connect Plus plan and our Touch plans are also offered. For our diabetes, the one thing to understand, of course, there's two types of diabetes. There's that type 1, which is our severe chronic form of diabetes caused by insufficient production of insulin. They're typically insulin dependent, but they don't have to be qualified to be on our diabetic plan. It's just that they've had a diagnosis of that diabetes in their medical history. Our type 2 is that mild form of diabetes. They're not typically non-insulin dependent, but for each of those categories, that would qualify them for our diabetic plan. And we do just try to offer all the support to really kind of keep that managed for their A1Cs. You've heard of different levels, 6 to 7 is kind of that marker that folks coming in with diabetes, we will analyze, figure out how we can bring it less than 6. If someone's extremely higher than a 7, that's where we're in having appointments within our care centers, within their physician's office, within their specialist offices, to really coordinate a plan to try to bring that down. With those programs, again, this is the services. You're kind of thinking, well, how do you do that? We do that through our routine podiatry care. So we have all of our patients come in at a minimum of once a month. That's where they're going to inspect their limbs, check for any calluses, trim their toenails, make sure they have the sensation in their feet, and really try to keep their feet as healthy as we can. We do have a wound care. So if and when they do have a cut, or if they have any gangrene in their toenails, we will actually treat them right there on the spot. Again, just to try to be preventive and try to manage through that. Again, a lot of our seniors, let's face it, they can't bend over or maybe have a hard time even seeing their toes. That's where we want to take that responsibility and keep it as healthy as we can. A lot of nutritional counseling. Again, it's quite unique. It's catered to our senior in mind. It's not putting these folks on a diet per se, but it's really bringing them in to have them understand how to make healthier choices in moderations. Maybe not the bread, but maybe a vegetable instead. Or they have salt, maybe putting pepper. And again, the little things that really make a difference to really kind of help manage that nutrition. We do have our exercise and strength program. It's our Nifty After 50. Some of you have heard of it. Again, it's a little different than your typical gym. It's less intimidating because all of the equipment is air pressured, meaning it is sensitive to our seniors. It is very sensitive to their muscles. Again, we don't want them to hurt or strain or stress themselves. The last thing we want a senior to do is to have aches and pains or sore because then they'll never exercise a day in their life. So we do bring them in. We have our kinesiologist who's there on staff. They manage through, come up with a specific plan for their particular needs to really kind of make that exercise fun, easier, less intimidating, so then it becomes a natural routine for them. And before you know it, they enjoy it. Of course, they become stronger in their muscles and then in their bone mass, and they're less likely to fall. They're less likely to trip. And that's where we're trying to eliminate all of those other, catastrophic types of scenarios. We do a lot of self-management techniques. Again, everything they learn through our programs at our care centers, we can involve family members. We can involve caregivers. So then they can self-manage and really kind of take all of the things that they learn in different techniques there at the convenience of their own home. And of course, education is the key to everything. We do have regular meetings, different newsletters that go out specifically to whatever the case might be for that chronic condition. Counseling's included. We do have a full mental health staff. So if we have any of our seniors who are dealing with depression or maybe the ill, will of, dealing with a frail condition or a chronic condition, we want them to come in pretty regular to talk that through. Again, family members are always invited to really kind of have them full body, spirit, and mind, very positive in nature. We find that that really eliminates a lot of the, kind of craziness that can happen of where that evolves to. For our Breathe plan, again, this plan is designed exclusively for those chronic lung diseases, of course, that chronic obstructive pulmonary disease. Um, you can really kind of point these folks out. They're the ones who are, generally with those oxygen tanks. The qualifying conditions for those is chronic asthma, chronic bronchitis, chronic emphysema, and that pulmonary fibrosis. So if they have COPD, say you enroll them with Caremore, we do have services that we can really try to help them help themselves, really trying to increase that lung capacity. We're not going to be able to probably ever get them off of oxygen, but what we're going to do is teach and train them and have them increase their lung capacity. So maybe if they're not able to, walk up some stairs or maybe walk outside, that through, kind of our programs, they might be able in the future be able to walk upstairs or walk outside or go check their mail. Again, that's our goal, is just baby steps to really kind of help manage through that condition so they can live a long, happy life in dealing with those concerns. So we do that through comprehensive pulmonary medical assessment, really finding out, what medications they're on, what's their levels of their oxygen. We do a specialized breathing test. Again, all the self-management skills that they learn at the care centers, they can take home. A lot of medicine management, again, really trying to analyze, why are they taking one medication that might be offsetting another, that might not make them feel as great. We do a lot of that through our own pharmacists that we have on site and available at each of our care centers. And then again, the enhanced nutritional training that we do through a nutritionist and a dietitian. We have pulmonary rehabilitation. Again, that's really trying to help through exercises increase that lung capacity. And last but not least is that stop smoking program. Any of our seniors who have, of course, tried to do that in the past, we do offer Chantix and we offer other measures that we can really try to eliminate them if they are still smoking to maybe possibly stop. And that's, of course, all provided through group education. Moving on to our heart. Now, this plan is designed exclusively for the needs for those beneficiaries that have been diagnosed with our cardiovascular disorders, of course, our chronic heart failure. So for these are all the list of the different conditions that would qualify them for the heart. Afterwards, I definitely can get you these slides, so if you want to review it later, you'll have it available. Again, this is all available on that broker portal as well. But these are highlighting all of those special conditions that would, of course, qualify them. The congestive heart failure, cardiovascular disorders, coronary artery disease, that cardiorhythmia, heart attack, or irregular heartbeat. Now, understand skipping a beat doesn't qualify, but if they've been diagnosed that they have a irregular heartbeat, then that would qualify. Peripheral vascular disease, that angioplasty, any stents, any heart bypass surgery, atrial fibrillation, I'm saying it wrong, of course, our cardiovascular thrombotic disorder, blood clots more than once, if they've had a pacemaker, and that pulmonary hypertension. It can't be hypertension, it needs to be the pulmonary hypertension. So for our congestive heart failure programs, again, a lot of specifics that we do offer there at the care centers. Again, this is all in coordination with the primary care, with any specialists that they might see. If they do have a cardiologist, we will definitely inform them of the different programs that they get initiated there at our care centers. So those programs would include, of course, the exercise and strength training, again, through our Nifty After 50. We do offer them that electronic weight monitoring scale, again, just to make sure it's overnight. We don't want their lungs to fill with fluid. All of their medicine management, again, that's through that anticoagulation clinic, just to make sure their blood thinners are the right amount so it's not too thin or too low. enhanced nutritional training, of course, member educational services and classes and materials. And then if they are smoking, of course, to get them to stop smoking with that smoking cessation programs. For our ESRD, these are our end-stage renal disease requiring dialysis. Um, if and when you have a patient, let me know in advance and I can get you the dialysis centers. Do understand with us being an HMO, if they are a particular dialysis center that we are not contracted with, you do want to make that, kind of choice and find out with them whether or not it's in their best interest to transfer. We don't ever want to interrupt any type of continuity of care. We do have the major, what is it? It's um, I just lost the one. Your major one here in LA County, we do contract with that one here. It starts with a D. I'll think of it here in a minute. Anyways, for the end stage renal disease, that occurs when the kidneys are no longer able to function at a level needed for our day to day life. It usually occurs with a chronic kidney disease and has worsened to a point which this function is less than 10% of normal. People with end stage renal disease require dialysis or a kidney transplant. For any of our folks, if they did already have a kidney transplant, they typically won't qualify for the ESRD plan because, of course, that means that they've already kind of taken care of that treatment of it not being functional anymore. But let me know, we all understand there's different stages of ESRD. There's stage 1, 2, 3, 4, and 5. Let me know so then we can help determine whether or not they would qualify for this plan. For our ESRD plan, now I'm talking specifically for LA Orange County, do understand they do get a $25 Part B monthly premium reduction. Again, I kind of mentioned that at the beginning for our healthiest senior, our Start Smart folks, they get a $50 premium reduction, where this is almost on the other end. Our most frail folks, we want to help them as well, where we give them a $25 Part B monthly premium reduction. So they can earn that $300 in an annual year. We do get 150 one-way transportation trips to dialysis and any care center appointments. So that's all at zero copay. Again, we want to help them get to and from. Again, know that number is up to our discretion. So if there are particular, situations that we need them to get to a care center or they can't get to that dialysis appointment, by all means, reach out to our member services or let me be that advocate for you and we can help that patient along because we really don't want it to be that they are missing any of their dialysis or care center appointments. Last but not least is our, this is still talking, of course, our kidney disease program. I'm sorry, the ESRD. For that specific services for them, we do the wound care management and supplies. We have ongoing evaluations for their dialysis treatments. We do that medicine management, enhanced nutritional training, individualized educational classes. Now, this is key. Again, it's kind of learning through how to live with that ESRD, bringing in family members or caregivers to really understand case by case, specific member by member. We will individualize those classes for that particular person. And then, of course, group educational materials and seminars and scheduled training classes if they do need. For our Connect Plus plan, now let's talk about our low-income Medicare eligibles. They definitely have good reasons to join Caremore Connect Plus. These really kind of help connect all of the different things that they are getting through Medicaid, Medicare, and any of the programs and services that we offer through our care centers, along with them seeing any of our primary care and any of our specialists. Now, for that eligibility, they do need to have full dual eligibility. We all know that's full Medicaid, full Medi-Cal. So as long as they have that full dual, they would be eligible for our plan. And I wanted to apologize in advance. I know there was a little bit of a hiccup, whether or not we had programs or plans on our DSNP Connect plan. We are no longer offering that this year. It is only the Connect Plus. So some of you who have been selling us in the past, or maybe, got a hold of a program, I want to just be sure it is the purple booklet, and it will have Connect Plus on the front. As long as you have that Connect Plus, then you have the right plan to enroll them. And then, of course, this is state by state. We're talking specifically for our California markets that we are offering this. For our touch plan, these are our folks that are living in a nursing home, maybe in a community or assisted living. The one caveat to this, again, we have to make sure that they are contracted with Caremore in order to offer these services to them. If you know of a facility, maybe you have existing members, let me know and I can help you along with any of those questions. If you happen to have some point of contact or, kind of need, we can help you with that. So the enrollment is limited to individuals who meet these specific eligibility requirements. They must reside or plan to reside and require an institutional level of care and need for that level of care have already lasted 90 days or longer. The SNP or this nursing facility must have a contract with Caremore in order for that individual to enroll in the plan. Individuals living in the community who required an equivalent level of care to these individuals, if they might be in group homes or things like that, there's all kinds of different homes. Let me know in advance and I can let you know whether or not they're Caremore approved before we offer that plan. But again, it's everything that we talked about in specialized programs of nutrition, diet, exercise, that medicine management, making sure their blood pressures, their heart, all of that we typically would do at a care center. Now we offer it to them bedside there at that assisted living. It's a lot of coordination with case management, with nurse practitioners, with any of that clinical staff at that particular community or nursing home. There's a lot of coordination of care just to really kind of stabilize whatever chronic condition that this patient might be dealing with, to offer it their bedside to them. So then they don't have to worry about transportation or coming to any of those medical appointments at a care center or at their physician's office. All of that treatment and specialized care is taken there to the facility of where they reside. For our Start Smart Plus, this is for our LA, Orange County, and San Bernardino. I mentioned the ESRD. Remember, that's the one that has the $25 Part B monthly premium reduction. For our Start Smart, they get a credit of $50 off of that Part B monthly premium. It does include silver sneakers at zero cost. They do also have access to a chiropractic. Again, Start Smart, again, is you're pretty active, very active, probably still very, wanting to go to their own gym. They don't want to come to our NIPTY after 50. Hence, for this plan specifically only is the silver sneakers at zero cost. The chiropractic, 12 visits once a month, $20 copay. And because these folks are generally still active, very healthy, pretty much still traveling, they do offer and they are entitled to that $25,000 emergency worldwide coverage. If they are visiting Mexico or out of the country, say they have an emergency or they have some type of medical need, all they will need to do is keep all of those receipts wherever they are out of the country. Once they are back, bring those receipts equaling up to $25,000. They would give those to Caremore, and Caremore would reimburse them. So that is a worldwide coverage for any of our Start Smart Plus folks. All the other benefits, I wanted to just kind of give you a brief highlight. These are for our SNP plans, again, it being that diabetic, your heart, COPD, or our Value Plus. All zero premium, maximum out of pocket is that $3,000. Again, we all know any copays will accumulate. This is their safety net, but I'm telling you, there's probably very few that hit that out of pocket with Caremore because, again, of all the lower copays. Any inpatient hospital, all zero. We have our days 1 through 90, zero. Say if they are released from the hospital but not quite ready to come home, they typically would be referred to a skilled nursing facility, and again, they have zero copay. So when you're looking at it, it pretty much is 110 days, all covered at no cost. Any of their primary care physician visits are all zero copay, and any of those specialist visits at our care centers are zero copay. Now, the one thing to mention, they might be seeing a specialist within our network. That is a $25 copay, but we do offer a lot of these specialized services with specialists at the care center. They don't have to come to this care center. It's a choice for them. If they do decide to come to a care center, then it's a zero cost. We have a cardiologist. We have a podiatrist. We have a nutritionist, a dietitian. We have a physical therapist. We have all of our mental health specialists. And we even have a dermatology in some of our locations. And we just started pulmonology in some of our care centers. So again, going to our website, it will designate the care center of which specialties are at those locations. So if you have any questions, by all means, you can reach out to me directly. But if they see any specialists there at the care center, it's all at zero cost. Emergency room care, it's $65, again, waived if admitted. And then our urgent care, we encourage, if it's on the weekend or if a senior's not feeling so great, again, they know it's not emergent to go to the hospital, always go to an urgent care. It is at zero cost. For our Connect Plus benefits, now this is kind of putting side by side, just in case it's making us do this, because we all know things change in income levels. If for any reason, say a qualification for that full dual changes, they would revert back to the Medicare only. I do want to concentrate on that far right column. Again, these are your full duals, full Medicare, full Medicaid, of course, zero premium, zero copay, any visits, all of your chiropractic included for the 20 visits, any routine foot care. We do offer transportation. Again, it's saying 40 trips. We can make that different if we need to, case by case, if they are missing appointments. But those are all their transportation to any of their physician's offices, any to their care centers, any to the specialist office. It will be included at no cost. We do have an enhanced dental program, and we also do have hearing aids available. It is $2,000 per ear. So it is a total of $4,000 for both ears. For our Part D, for any prescriptions, yes, zero copay, and also no deductible, depending on what tier that it qualifies. Of course, typically all of yours, your generics, preferred generics, are all at zero. It's really your specialty type drugs that end up being at that $660. But let me know if you have any concerns or questions. I know most of you as brokers in your specialty, might get calls of folks who are maybe hitting or close to the donut hole. That's where I want to help you, because we do have our internal pharmacists that can kind of help these folks help themselves to really kind of eliminate that scare that they don't even have to be concerned about having to ever pay out of pocket for any type of medications. That's the last thing I want to have happen with any of our seniors. I did want to mention we are still offering, for some of you took advantage of our gas reimbursement that we did during open enrollment. We wanted to say thank you and continue through lock-in. So whether or not you have this fax cover sheet, you can utilize your own or utilize the one that you might be sending in through Team Alvarez. The key thing is I want to make sure you know the fax numbers of where to send in the applications. You're just going to put your name, your ID, what FMO, Team Alvarez, of course, and that date, and it will give you a list of all of the different forms that you have to send in. Now, just trust, I am working on an online application. I was hoping to have my IT have that all utilized and ready to go January 1st. Unfortunately, it's still working through some bugs, but in the near future, we at Caremore will be able to get rid of this whole faxing type of circumstance and be able to offer you online applications. Unfortunately, it's not today, but I'll keep you abreast and keep you updated when that is available. It's definitely something that I know, as being a selling agent myself, the last thing I want to be doing is faxing in applications, so we are working on that for you. But in the meantime, I do want you to include these on these fax cover sheet, whether it's your own or Team Alvarez. Just really put the word mileage and circle it. We will reimburse you from the time you leave your office or your home to that appointment and returning, whatever that mileage is, we will reimburse 56 cents per mile. Afterwards, what we will do is send you a Chevron Caremore gas card. It's your own little debit card of gas through Chevron. Depending on what that accumulation each month, we will give you a statement at the end of the month. So I don't want you to throw away that Caremore gas card once you utilize it once. Keep it in your wallet, keep it in your purse, because as you accumulate more enrollments for Caremore, we will be throwing more money on that account. So you can get credited for all of the, of course, crazy expense for gas for you to utilize your business throughout the day. Any questions? Hopefully, Emmanuel, if you don't mind opening up the lines, and then I can offer any questions. I'll forward this presentation afterwards to each of your emails so you can refer. Again, I know it was a lot of information that I rambled through pretty quickly, but hopefully it just puts you in a better position to understand all of the special needs plans that we have available through Caremore. This is our time. This is our specialty. We really do embrace lock-in. It's not the time to stop working. It's actually the time when we are working the most. So hopefully that will help you in any of your appointments. If you think of somebody who has those chronic conditions, you ultimately think of Caremore as maybe being an option for them. So I thank you for your support.
Absolutely, Barbara. Thank you very much for doing this for us. A participant, you can hit *6 to unmute yourself and ask your question. Please make sure that once your question is asked, you hit *6 again to mute yourself and not have any background noise. Anybody have a question? You can also use the chat box to have to ask any questions.
I see everybody put their name, so good job.
Absolutely. I'm still waiting for viewer 11 and viewer 12. I need your names, please. Viewer 11 and viewer 12.
Very good. Well, I'll let you get back to your business. Again, have a great Monday, a successful lock-in. We sincerely appreciate all your support during this last annual enrollment and looking forward to a successful 2016. Thank you, Team Alvarez.
Thank you, Barbara. You have a great day.
You too.